This video is about DayQuil Cold and Flu. DayQuil Cold and Flu contains 325 milligrams of acetaminophen, 10 milligrams of dextromethorphan, and 5 milligrams of phenylephrine, all put into a liquid capsule. Each of DayQuil Cold and Flu's three components have different mechanisms of action. The first component, acetaminophen, works by acting in the brain to stop production of prostaglandins, or inflammatory substances, and it also increases pain tolerance. Another mechanism of action of acetaminophen is to reduce fever by stopping the production of fever-producing substances in the brain. DayQuil Cold and Flu's second component, dextromethorphan, decreases activity in the area of the brain that causes coughing. DayQuil Cold and Flu's third component, phenylephrine, reduces swelling in blood vessels and nasal passages. DayQuil Cold and Flu's main use is to treat coughing and colds. Adults and children over the age of 11 should take 2 DayQuil capsules by mouth every 4 hours as directed for temporary relief. Children between the ages of 4 and 11 should consult their doctor before taking this medication. Children below the age of 4 should avoid this medication altogether. Adverse effects of DayQuil Cold and Flu include dizziness, drowsiness, and nervousness. If you're considering taking DayQuil, you should think about whether or not you have any of these exclusions for self-care. You shouldn't take DayQuil if you have liver disease or heart disease, if you have a medical history of high blood pressure, if you're currently suffering from thyroid disease, if you have diabetes, if you have difficulty urinating due to a swollen prostate gland, or if you have a cough due to chronic conditions such as asthma, emphysema, bronchitis, or smoking. In addition to the exclusions for self-care, you should also avoid taking DayQuil if you're already taking other over-the-counter or prescription products containing acetaminophen, if you're currently taking monoamine oxidase inhibitors, or you've stopped taking monoamine oxidase inhibitors in the last 2 weeks, or if your cough produces too much mucus. If you're currently taking DayQuil, you should stop use and ask your doctor if you experience nervousness, dizziness, or sleepiness, if you persistently experience cough, congestion, and pain for longer than 7 days, if you persistently experience fever for longer than 3 days, if you experience redness or swelling, if you notice any new symptoms while taking DayQuil, or if you experience a cough along with a rash or a headache. Special instructions for DayQuil Cold and Flu include: avoid taking other over-the-counter medications containing acetaminophen, do not take more than 4 doses of DayQuil in a given day, and while taking this product, avoid having more than 3 alcoholic beverages per day.